start the recording as well. You got it. Okay, so spine straight, neck and shoulders relaxed, chin tuck, lengthen from the crown of your head. Just observe your breathing. Observe the way you inhale and exhale. Yogena chittasya padena vacham malam charirasya vaidyakena yopakarotam pravaram munina patanjalim pranjaliranatosmi. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Gurur Sakshat Parabrahma, Tasmai Shri Gurave Namaha. Tasmai Shri.
So, your video and sound is frozen. Yeah, I think there must be an error. We just have to give it time for him to log in again. It's just sometimes just happens because of the internet weak. It just disconnects and makes the second person the host that it's done now. There he's logging on again.
Yeah.
Okay,
yes, sir.
I'm again here.
Yes.
Okay, sorry. Some error from my end, it seems. Net issues coming in. Okay. Just a second. Patels. Okay. Okay, so Namaste Sana. Okay, so where were we? We were at the shoulder socket joint. We were going towards the rotator cuff, and then we had last 3-4 slides left. Yeah, so
Yes,
let's
sir.
go with those 3-4 slides. Okay, and have a quick recap also might be.
Yes.
A quick recap also. That's better. Okay, so we were here. Okay, let's go with fast. Okay, just a sec. Okay. There seems an internet issue, net issue today. It's coming and going, you know. Just a sec. You can see me?
Yes, sir.
No, definitely. You can see me? Okay, but I can't see you also. Anyhow, it might come.
Even the shared screen you can see well. The shoulder
Acha,
joint.
okay. Then now I can see you. Yeah, I can see you now. What should I do? Okay, hide floating video panels and hide floating meeting controls. Perfect, I'm there. And let me go through. Perfect, I can see you all. Okay, here it is. Okay, so just have a quick recap of what we talked about. Okay, we went through that it's unstable joint and everything because of the way it is made compared to the hip joint. The shoulder socket joint is a more unstable joint just because the groove and the the groove and the where the humerus goes is very like a plate type, And we talked about the acromion process, more range of motion, more surrounded by soft tissues, ligaments, and tendon. And that's the reason you have more frozen shoulders. You will never have a frozen hip, but you definitely have a frozen shoulder. There's a reason. See, legs you use in all the directions, right? But shoulders you only use in one direction, that is forward. So there is a lack of mobility in the shoulder. Now a shoulder socket joint is a complete movement, right? This is we don't do. We are always doing in front, while the leg is moving front, back, sideways, something or the other happening. But the reason behind the frozen shoulder happen, that is adhesive capsulitis, the anatomical term, is just because adhesion is formed, right? So that's the reason it's very important that you move the shoulder. The only problem is people don't move their shoulder. Why? Because what is this? This doesn't excite me. This doesn't excite me. That's the only thing. Nothing else doesn't excite me to do something like, what is this? It doesn't look like someone is saying do fingers like this. So there is a value. People do it. So surrounded bone. So instead of the bony thing, it is more surrounded by what? Ligament, tendon, and muscles. Okay. Stabilization by shoulder done by sits and deltoids. We went through underwork muscle. Okay. Scapula humeral rhythm. I talked about the movement. When you move the arm, the scapula also moves together. And that's the reason it's on a scapula humeral rhythm. So whenever I move the arm, I lift the arm. So, but the only thing you need to check here is, I am not elevating. Okay. That's the very important thing in all these things. Whenever people lift the arm, because of their upper traps and the scapula, not the upper traps and what? The levator scapulae. Yeah, upper traps and the levator scapulae being tight, they are habitual to elevate. They're habitual to elevate. So you'll say, okay, relax the shoulder. Yeah, relax the shoulder. But never say, don't give the cueing, push the shoulder down. Because what will happen then? You're doing two opposite movement. You are lifting the arms up and you're telling the person, push the shoulder down. That is against the scapulohumeral rhythm. Got it? So there is a movement, let that movement happen. So we went through all that things, rhythm, flexion, without elevation, foam rollers. I talked about foam rollers. Work on the rhomboids. There is agonist and serratus anterior, that is antagonist. Very important point to remember that I want you to also work on serratus anterior, okay, and rhomboids. And what exercise I told you? The straight arm movement, right? Remember the straight arm movement? We went through that. Okay, then we talked about the deltoids, anterior, lateral, posterior. Okay, these are what? Also a stabilizer, superficial muscle of the shoulder. Yeah, Greek. We went through all these things, right? Different directions, stabilizing it. Okay, anterior deltoid, reverse namaste. These are some of the exercises we went through. Elbow interlaced. Yeah, tie due to desk walk, medial, warrior two. Any lateral raise will work. Posterior deltoids. We need to work on posterior deltoids more. Okay. Why? Because we are habitually anterior, habitually using more of the anterior in contraction. So we need to do something that will posteriorly, stretch. Okay. So, sword and all these things. We talked about the TheraBand and everything, injury, holding a weight away from you. These are the strong stabilizers of your arm. So all the arm balancing, that's the deltoids are good to work on. Okay. So all these we went through: rotator cuff muscle, supraspinatus, infraspinatus, teres minor, and subscapularis. That's the reason it's known as. Now I want you to remember this, rotator cuff. What a rotator cuff muscle? Sits, S-I-T-S. And I want you to remember sits, supraspinatus, infraspinatus, teres minor, subscapularis. Okay. Acromion process. Remember the whole image to let you know that there are different types of acromion process: type 1, type 2, and type 3. Type 3 one, that is like a hook, can create more problem with people, when they lift the arm, say, oh, I'm getting a pain here. Oh, I'm getting a pain here. Yeah, it depends, sometimes the bone spur being formed, extra bone being formed. Yeah. Sits, strength and stability, assist in shoulder rotations. We went through all these things, the glenoid cavity and everything, underwork muscle. Yeah. Oh, that's fine. Okay. Then supra. Supra means on the top, right? Supra. Namaste, Cherry. Yeah.
Namaste.
Supra means on the top. Spinatus, spine of the scapula. Okay. Yep. Namaste. So superior located, what is the job it is doing? This movement. When the insertion pulls the origin, right? We went through that. Okay. Lateral raise, once again, a cause of rotator cuff injury. infra, okay, infraspinatus, that is down. Supra was on the top, infra means down, okay. Inferior, supra means superior, infra means inferior. Okay, what is doing? External rotation. So once again, we need to strengthen the external rotation, that are your infraspinatus. So keep the thing in mind. I told you this movement. Yesterday, Meenakshi was talking about that rotation. Yeah. So it's synergist to teres minor. That means yeah. Yes, exactly. So you can do a ipsilateral or unilateral single arm. Okay, with tying that thing over there, or you can. Oh, I always use these bands. Okay, can you see me? Yeah. Right. I use these bands. Okay. And I do this one. Got it? So these bands are amazing to work on. And then when she was talking about unilateral, I can hold one hand as a stabilizer and I can move the other arm as a mobilizer. Got it?
Yes.
So this is the way I have lots of different, it's like, it's, it's a binded one. So it's much easier to work on. And there are many things that you can do with that. Okay, so infraspinatus is once again a very important muscle to be worked on. And in anatomy books, sit muscles are mostly used when we talk about shoulder. Any shoulder injury, that will tell you that, okay, this infraspinatus, this muscle, subscapularis, at least you should know that. That's the reason I want, for all the shoulder socket injuries, I want you to know the group muscle that is sits. Okay, supraspinatus, infraspinatus, teres major, and subscapularis. Okay, tightness limits reverse prayer. So whenever it is like this, because of these muscles being tight, what will happen? This movement will become difficult. It's all because of posture, nothing else, teres minor, we went through it. External rotation, once again, synergist to the infraspinatus, both working the same work, right? The previous one and this one went through that same movement. Okay, then we talked about subscapularis. Now this is the muscle that is always tight because it is leading you to internal rotation, right? Sub means below the scapula. Sub means below the scapula, subscapularis. Okay, tightness and weakness is always there. So it doesn't mean tight, doesn't mean strong. Okay, tight means also weak, right? So these are some of the asanas that will create problems with movement. Okay, went through that's also for cause of rotator cuff. Now we come with the cause of impingement. Okay, sits, mobility and strengthening. Mobility and strengthening. Now, what is that mobility and strengthening? A mobility of something like this. This mobility. A mobility like something where I'm in a forward bend position. Like, for example, it's like I'm in this position, forward bend position, and I'm just rotating the arm.
Yes.
So clockwise, anti-clockwise, pendulum movement, and very relaxedly, wherever there's a tightness being formed, no, it will progressively release when I'm, just doing both the arms very passively. I'm not putting any weight, my friends. It's the arm weight that is giving the stretch. Otherwise, I'm not doing anything. Pendulum movement, front and back movement, circular movement. All these things are very important. Added. That is what we talk about, mobility. And then strength, I talk about using the bands, right? The bands using the strength in. Now, I haven't mentioned it, but whenever you're using this, think about is 3 p.m. So in 3 p.m., you're doing out and back. Okay. Then 12 p.m. Okay. Think about the clock and go in all the directions you can. 3 p.m., 2 p.m., 1 p.m. So what I'm doing is this movement. So now I'm doing it very fast, but you have to actually go very slow. Okay. So all these movements, when you do inhale, exhale, this will help to strengthen the rotator cuff muscles. Okay. So add up, just make it a note because I haven't mentioned in here. It just came into my mind. Yeah. Okay. Work on, Subhash, I forgot to just message me about the link, about the TheraBand link. I will share that with you. Work on chest openers. So all chest openers, very clear. Yeah. When chest drops, shoulder rolls forward and down, shoulder blades tips forward. Shoulder blades tips forward. That means what happens? Two things happen. Shoulder blades goes up and out. And that is the reason whenever the shoulder blades goes up, which is the muscle that works more? Upper trapezius, and the levator scapulae gets tightened. What we need to do is bring the shoulder blades back to its pocket. That means midline. That is midline. So whenever you see someone with shoulder blades, a hunch forward, their shoulder blades will be away from the midline of the spine. And we need to correct them by doing the Y, L, W, by working on some strengthening, therabands, all these things. A mix and match, not only yoga, my friends. Definitely yoga, because it talks about breathing, mental state and everything. But yes, some type of additional exercises or strength training is required, and nothing like TheraBand. I don't use weights. I always use a TheraBand. It's much safer and easier and cheap to buy than having a dumbbell of different plates. And that's I can carry those TheraBand for my students. Might be after 1-2 weeks I can say you can buy it now. You know what it is. Okay, acromion process hits the head of the humerus. What is that? Impingement is caused when I'm lifting. I told you there are 3 types of acromion process. One is the hook one is the flat. If I take it up, sometimes that impingement is there. And the doctor recommends to go for an operation, for a surgery to remove that excess hook, okay, or the excess bone that is formed. Otherwise, people live their life without that also. There is no problem. But when you go through surgery, a small bone is just removed, the hook is just removed, and then the problem is not there. Yeah, but people just avoid it. Yeah. Now remember, as I told you, every acromion process of individual is different. Not everyone do this and has a click click sound. Few people would have, few people will not have. Yeah, it just depends upon how your acromion process is. Yeah, and which angle it will hit the humerus, that is your arm bone, upper arm bone. Okay. Rotator cuff more likely to be impinged and strained. The whole rotator cuff muscles, it can, eventually become inflamed and more prone to tears. And that happens when people actually don't use mobility. People don't do mobility exercises because it is so simple. It's like what it is. I'm doing it daily, every day I'm moving. No, but you're moving in only one direction. Yeah. And that's the reason, my friends, once again, I come back to square one, Pavan Muktasan series of Bihar School of Yoga. Yeah. Always don't miss that. Don't miss that. Always keep hitting Pavan Muktasan series. On therapy point of view, 100%, my friends. Don't miss that out. Yeah. Now, frozen shoulders are also known as adhesive capsulitis. Okay. Now, the clock movement that I showed you, those are for your frozen shoulders, adhesive capsulitis. Yeah. We call it in simple language, we call it frozen shoulders. Doctors say adhesive capsulitis, but that term is rarely used, frozen shoulders. Okay. Now, if you see the image below, the white one and the one that is actually frozen, so tightened out there, let's go with this. Movement of shoulder becomes limited. Movement. Now, there are many reasons movement of shoulder come. If I had a fracture in my wrist or in my elbow, and I was wearing a sling for 1 month. So actually my wrist healed, but my shoulder started giving a problem because for 1 month I was into a cast and I was doing like this, right? So it might happen that this problem is solved and the elbow problem is solved, but the shoulder joint, because you are not doing anything to the shoulder. So after some time, the shoulder issue does, for some people it is not like for all, but some people does. Shoulder joint capsule becomes thick, stiff, and inflamed. Yeah, that's the reason mobility is important. Lack of use, add circumduction. Simple circumduction. Yeah, circumduction. It's friends. It is not that you don't know. The only thing is you have never given importance to it, and I'm saying just give importance to it. You got it? Adult 40s. So it's common in age group of 40 to 60. Very common people coming with shoulder issues. So it is good. Prevention is better than cure. Prevention is better than when someone is coming to a class. Why don't you add these things beforehand to let them know why we are doing it? When you give them the reason anatomically, we are doing it because people are actually having a lot of frozen shoulders, and this movement is very important. So people do it. Give them fear of frozen shoulders. Give them fear of some problem coming in. They will do it. Got it. Give some example of some patients. Any shoulder injury, shoulder brace, I talked about, sling, shoulder wrap, rotator cuff tear, fracture of the shoulder, elbow, collarbone, or upper arm. This is all can be possible. Even any fracture happening to the shoulder socket joint can also lead to a frozen shoulders too, because for that particular time, you're not moving your shoulder socket joint. That's the reason it's very important to know. Now, also what happens with, apart from that, people who are having diabetes or chronic arthritis, a stroke, underactive or hyperactive thyroidism, Parkinson disease, and heart disease would also have frozen shoulders. Okay, will also have frozen shoulders. So it's not only with accidents or a sling or anything, but diabetes, chronic arthritis, Parkinson disease, and heart disease do have. And the worst case is your rheumatoid arthritis, RA. Okay, osteoarthritis, it's more of muscle, working on the muscle. But rheumatoid arthritis is every time the pain keeps rotating. Sometimes it is on the fingers, sometimes it's the shoulder, sometimes on the elbow. Yeah, so that is something a very difficult one. So if you get an osteoarthritis, no problem. But rheumatoid, you have to think about which joint is not paining today. Let's do on that joint. You got it. Now, these are band exercise that I find it very, very, working. It's like, it's amazing. It's amazing work. Best for senior citizens. So I ask them to hold the band and do all those movements. So it can be a flexion. So from here, I take the arms up. Okay. Avoid using a belt, because your belt will go front and back. You will not have that stability, right? So when you use a stick, you will have a proper stability. So flexion, extension, okay. Isometric shoulder, external and internal rotation, okay. So you're holding it, okay. You're taking it sideways, front, back, hold it there for some time. Isometric is static holding, right? External rotation, like, you're standing, I normally do in the train. I hold the railings behind and I stand and I push myself for at least a minute, So think about that. You find a rod over there, hold it there. All these things will work much better than specifically taking out time and doing it. Okay, flexion, extension, I talked about it. What is flexion? Flexion. From here to hip, I take flexion. What is extension? I take it back and I hold it. You can see the images being done. And that's the reason I add this. So what you need when you're sequencing your class, one day, use a stick, and tell your students, okay, today is a class we are doing with band exercises. So it would be very interesting also at the same time, something new than yoga actually. That will help. The days you can use TheraBands. I have asked my students to use TheraBands, yoga ball, foam rollers. I ask them to buy it. And they have bought it, all have them. So what happens? Every day, a different group of muscles are being worked. Stability is being challenged. Mobility is being worked on, So the more variation you teach, as I have told you earlier, it will make a huge difference. So the band exercises are very good. You need to always use it, something or the other. Supine horizontal abduction. So I hold it, take it to the sides, all these movements are just amazing. Seated standing. So yes, okay. Shoulder abduction and adduction. So standing, movement to the sides, okay. Movements front, all these movements would help to work on the shoulder socket joint. Then you can use a TheraBand like this, work on it. Okay, take it back and down, right, back and down. So all these movement will work, somewhere it will be mobilizing, somewhere it will be stabilizing. Why not add as much as variation you can think of? You have to actually write a sequence. Okay, today this is what it is. We'll do mobility first. Okay, then we do band, then we do strengthening. So in actually 1 hour, you can do complete shoulder socket rotation. And it's a good sequence for the whole shoulders, from mobilizing, doing the deltoid stretches, reverse namaste, think about hands going up and back, all these movements, the vinyasa flow of Swami Ramakrishna, I think. Yeah. There's one book on vinyasa flow where it has all the shoulder rotation, a little bit here and there. Yeah. Then Gomukhasana, right? Gomukhasana is very standard everywhere. Gomukhasana is one of the best, as we were talking about yesterday. Even Meenakshi said that it's amazing. Baddha Virabhadrasana. Okay. What is Dandasana? So Baddha is holding it behind. Okay. And then doing a Virabhadrasana. Okay. Dandasana. Bharmasana is a tabletop. Okay. The tabletop Bharmasana. Okay, standing arm circles. I told you the standing arm circles. Yeah, that was in a forward bend position. Dandasana ladder drill. So what I do is I hold it one. So think about I'm in a plank. Okay. Now what I do? Front, back, sideways, sideways. Got it? So basically I'm using a ladder and I'm doing all the arm movements to the sides, front, back, and this. This is where you're working. And don't forget the scapulae protraction and retraction. That is very important. Okay. Don't miss that out. Okay, hold the stretch for 30 seconds when I'm breathing. So I'm holding it there. I'm holding it for 30 seconds. I'm holding this. I'm holding it for 30 seconds and I'm stretching. So always try to give at least minimum 30 seconds of that stretch. I'm holding it there, maintaining it. I'm pulling and I can feel my scapula, my shoulder blades are coming midline of the body. 30 seconds of hold and come back. This is a very amazing stretch. Okay, pendulum and circular swings. I talked about it. Walking with your fingers. You know, sometimes patients come to your class, they cannot move their arm. So what I say, there is a wall, keep your hands on the wall and crawl. And crawl. Then crawl to the sides. Crawl with one arm. So all these movement of crawling, if they're coming at your place and they cannot move, they're finding it different. So walk with the fingers on the wall and see how they manage that. You know, with small movements. Okay, try it. How do you feel? Okay. Okay. You know, this is what it is. Crawling with the fingers front and side. Externally rotate the shoulder when you sleep. So always I try to, when you're sleeping on the supine position, just ask people to sometimes keep your hands behind like this and put your weight on the hands. And for might be 1-2 minutes, you know, make a habit of sleeping like this. It is already externally rotating your shoulder socket joints. Sometimes it's very good. And avoid, if people are having this pain, avoid them to sleep on the sides for a longer period of time. Even that also causes impingement. Yeah. Single shoulder rotation instead of double. Okay, so single shoulder. So instead of doing this movement, you can do just this one. Inhale. Now, when a person does this, it is more mindful. Inhale. Feel the stretch. Contract the upper back, middle back, lower back. So what happens? The awareness is more with single than double. Okay, fine. So that's the reason. It's very important that you do more singular movement, because then the awareness is more super slow. You have to really make them feel, okay, you're stretching the pec minor, okay, stretch major, what is happening? My anterior deltoids are getting stretched. My posterior deltoids are getting contracted. My infraspinatus is getting contracted. My subscapularis is getting stretched. Got it? Think in that manner. Think about these muscles. Eventually a stage will come when you will remember it, because now you have to think on the muscular point of view. Got it? It will take some time. It will take 2-3 years. And in fact, it will take lifelong to gradually, slowly, and, you know, add up. So don't be in a rush, my friends. I told you, I'm just giving you a spark. To make fire, it depends upon you. You got it? No. And that is the reason, search for patients who have a shoulder injury, who have a back injury. There is where your learning will start, my friends. 100%. Yeah. Whenever you get patients, get ready. Irrelevant of whatever it is, whatever they are paying. It is you will learn, because you actually get a live patient to actually, you know, start working on, right? So always welcome. Always. Yeah. Okay. That's it. This was for your shoulder socket joint. Is that clear? Any questions up till now about this?
There will be, when we refer back, there will be a lot of questions.
No, you're always welcome. Yeah. Yeah. So shoulder socket joint, think about therabands, think about mobility. Mobility is very important. What we are lacking, you know, mobility is such a simple exercise. Why should we do it? You got it? Yeah. But make it a point to do mobility. Pawan Muktasan series. If you haven't gone through Pawan Muktasan series of Bihar School of Yoga, I would highly recommend it. I will highly recommend it. Highly recommend. Since my life, I have only taught fitness people Vinyasa flow. Okay, yoga on the ball and Pilates. But therapy point of view, I have only and only relied on Pawan Muktasan series 1 and the gentle Hatha Yoga asanas. Gentle Hatha Yoga asanas. Got it? And it is enough. That is enough for their healing. Yeah?
So
okay,
if anybody wants a digital copy of that Pawan Muktasan series, please tell me. I have a whole book from my school. It is very big, but I can give just that Pavan Mukta Asan series and in a PDF format and send it.
Uh,
Anybody
in
wants?
fact, uh, in fact, Deepak, what I'll be doing is I will be actually sharing roughly 25 to 30 books where Bihar School of Yoga's asanas, pranayam, mudras, and bandhas. There's a book by Bihar School of Yoga that it's in the yellow color format, I think orange or something. So I'll be
Yeah.
definitely sharing, I think you should be having it also. Exactly. Yeah, exactly. It's one of the, in fact, my friends, I will tell you some of the books you should have hard copy. And this is one of the books I will highly recommend, instead of having a PDF, I will highly recommend to buy this book and keep with yourself.
I
Highly
use
recommend.
it on daily basis. On daily.
Exactly. It's like a Bible, my friend. It's like a Bible or a Bhagavad Gita for yogis, actually. Let me tell you that. Yeah. So make it a point to use it. Yeah. Very important book. Very important book. Okay. Some books you should always have it. This is one of those that you should have it. Okay. Otherwise, normally I'll be sharing a lot of PDF files with you. Okay. So it's 5:35 now. I am going to start with a new chapter. So let me give you a break here, okay? So that we can have a fresh start of pelvic floor, right? So it's 5:35 here, India. We'll take a 5 minutes break and we will come back. Yeah, is that okay?
Yes, sir. It's
Perfect.
perfect.
Perfect. Thank you so much. I'll see you. Okay. Come back. Subhash, Sana, Deepak, Cherry, and Mona. Namaste, Mona.
Namaste.
Okay, you're there. Good, good.
Yeah, I'm listening actually. I'm doing something else, but
I
my
can
ears and eyes on you only.
I can understand that. No worries, I can understand. Okay, so let us start. Now our topic is pelvic floor muscles, my friends. Okay, pelvic floor muscles, and it is once again a very important topic. How the core is, how the core is. Whenever we talk about core muscles, I told you about the multifidi. Ah, Cherry, you're looking good. Don't worry, Cherry.
Thank you
Okay.
very much.
Okay.
Mana, mana, Arili.
Nggak kemana-mana, di rumah aja, sedih deh.
Okay. Yeah. So as core is, you remember when we talk about core muscles include multifidi, diaphragm, and it also includes your pelvic floor muscles. Got it. Now what happens in yoga? We do have Ashwini Mudra, Moola Bandh, and the Kegels in India, the Western. These things are commonly used. But there are some things that we need to really understand because prolapse uterus, prolapsed, you can say, urinary incontinence, sorry, urinary incontinence, fecal incontinence. Okay, all these things are actually creating a lot of problem, and we actually don't realize what we should be doing it. So let us go with the slides on a pelvic floor group of muscles. Okay. Okay, share. Okay, here it is. You can see it. Perfect. Hmm. That's your pelvic floor and and play. Perfect. Okay, so that's your pelvic floor muscles. Okay, now it has layer 1, layer 2, layer 3. Lots of layers are there in pelvic floor, but we're talking about those that are required for us. Okay, we will not get into layer 1 and layer 2. Yeah. Okay, let's try to understand first pelvic organs. So what are the organs that are connected to the pelvic floor? Okay, so we have the bladder, we have the uterus, the female. Okay, let me tell you. Okay, bowel, uterus is for the female, right? Yeah, right. Anal region, right? And if any dysfunction, any loosening, remember, any loosening in the pelvic floor, any tightening in the pelvic floor can cause a problem. Okay, do you understand? It doesn't mean if the pelvic floor is tight, it is good, or the pelvic floor is weak. It should be toned muscle. Got it? It should be toned muscle. And that's the reason it is very important that you work on the pelvic floor muscles or pelvic diaphragm also. Like how we have a thoracic diaphragm, it is also known as a pelvic diaphragm. The words, yeah, used as a pelvic diaphragm. Now, how does they work? How do they work? Okay. And how they are closely connected with the breath. When I'm inhaling, what is happening to my diaphragm? Thoracic, it goes down like a piston, right? Then what happens to the pelvic diaphragm? The pelvic diaphragm also goes slightly down. It like moves in tandem. Okay. And that you can really feel better if you're doing a Purna Pavan Muktasan, that is hugging both the knee to the chest in a supine position, or also known as Apanasana. When you hug both the knee to the chest, what is happening? Whenever you inhale, the diaphragm pushes down, and because of the yes, exactly, yeah, Deepak, perfectly, yeah. That's your Apanasana, right? Whenever you are doing that posture of putting the knee to the chest, you are actually moving the pelvic floor muscle. And that's the reason, apart from Pavan Muktasana being good for the digestion and back and everything, it is also good for the pelvic floor muscles. Now, it depends upon how you're using it. You can use as a back pain. You can use as a digestive system. You can also use for the pelvic floor muscles. Now, what I tell people to do, when you inhale, feel the thoracic diaphragm going down and the anal region protruding out. Anal region protruding out. And when I exhale, feel the anal region coming back to its normal place and the diaphragm, thoracic diaphragm coming back to its normal place. Why? Because the thoracic and both work in unison. Both work in unison. So we need the pelvic floor muscles to be toned. Toned meaning it should have strength as well as flexibility. That means it can hold it properly when required and evacuate when required. That means release. So it can tighten when I need it and it should release when I need it. Right? Are you understanding what I'm trying to say? Yeah. Now, any issues with the pelvic? I have seen a student with prolapsed uterus at the stage 2. Okay, prolapsed uterus. So basically, the uterus is coming out of the vagina. Actually, okay, So in that cases, the Ashwini Mudra or the pelvic floor, like Kegel, helps a lot. But the only problem is when you stop doing it, you are back to square one. You got it? Because one of my students, I'm talking about at least 11 years back, she came with prolapsed uterus. So I started.
What was the age?
She was at the age of 42, for 39, 42 something, So, and she already had given at least 2 births, and that too, a normal delivery. Okay, even that normal delivery, my friends, creates a pressure to the pelvic floor muscles. Yeah. So that's the reason, especially a woman who has given birth, it's always good to work more on the pelvic floor muscles, pelvic floor, because, eventually a lot of pressure coming in at that region. And if you see, like I talked about Pavan Muktasana, that is the reason Malasana. What is Malasana? Squat. Malasana is very good for the pelvic floor muscles. The whole Indian call of nature is what? Malasana. Yeah. Absolutely. Right? The whole Indian call of nature is what? Malasana. And that's the reason it's a much better evacuation process than a Western one. Because in a Western one, there is the anal sphincters gets clogged. While in the Indian one, it's released. There is an anatomy. I'll share a video on the Indian and the Western toilet. I have made a video on it and with proper anatomical explanation. So that's the reason Malasana plays a very important role in actually working on the pelvic floor muscles. Okay, that means any problem to my pelvic floor can create a problem to my bladder. I cannot hold my bladder, so I can easily pass urine. That happens with senior citizens. That's the reason adult diapers have came into picture. Yes. Adult diapers, if you have heard about it. Why? Because they cannot hold it. The pelvic floor cannot contract the urethral sphincters. It happens with fecal incontinence. They cannot hold their anal sphincters. Yeah. And that's the reason, evacuation happens. And that's the reason adult diapers are also available. But friends, if we can, into our yogic practices like Setubandh, like Malasana, like Pavan Muktasana, if you can add these pelvic floor into a regular routine, irrelevant whether your student has a pelvic floor problem or not, can we add that thing in our sequencing? Why not? So whenever you do a Setu Bandhasan, a Pavan Muktasan, yeah, with hugging both the knee to chest, always add this. Or even Viprita Karni, or if you're doing a Sarvangasana, yeah, Viprita Karni, would be once again inversion, much better work for the pelvic floor muscles, because the pelvic floor muscles will now work against the gravity. Got it? When you're doing viparita karani. Yeah. So that's the reason. Let's go with that. So bladder, what is the pelvic floor muscles are doing? It is working on the bladder, uterus and vagina, prostate for men. So that means if there is any issue with my pelvic floor for male, what it can be erectile dysfunction. Can be erectile dysfunction. But if a person is regularly working on these movements, yeah, then it can be a possibility that he can be better. So a person with erectile dysfunction starts working on the pelvic floor muscles, amazing results, amazing results. Okay, the rectum, once again, I talked about that. Yeah. Now, important here, weak glutes and leg, tight pelvic floor. So normally what happens, weak glute and legs work in tandem with pelvic floor muscles. But if you are anteriorly tilted, what will happen to the glutes? The glutes will be loose. They will not be toned. Yeah. The legs would be weak. And if your glutes and legs are weak, you will have a tight pelvic floor. Why? Because the work that was done by the glutes is now done by the pelvic floor to create stability in the pelvic. What will happen? This will create more tightness in the pelvic floor muscles. So once again, a pelvic floor disorder. That's the reason the glute muscle, the buttock muscle, is once again a very important muscle to be worked on. Yeah. Proper training. That means anything where you can strengthen. Because remember, what is throughout the whole day we are doing? Even right now, what we are doing? We are seated on the glutes. What is happening to the glutes? The glutes are being pressed and it's being weakened. Can I do something for the glutes? Shalabhasan. Yeah. Bhujanga.
I think it's an internet issue, but you will be logging on back in a few seconds. Because it happened in the beginning also when we started. It went off and then it logged on again.
Oh, okay.
Yeah, it's just the internet, and like you see, it's disconnected completely, but it will come back in connection and then get us. We just need to be patient. So I don't know what happened, but there are a lot of friends who are missing today. Oh, it's there. Nandini is there, but she's not putting on a video. Then even Mona is there, but I think she hasn't put on a video. Yeah. Hi, Mona. Yeah, we understand. It's okay. As long as you're there. I was wondering, there's nobody today. Even Meenakshi is not there. But it happens. Sometimes you're busy or taken up.
Yeah. I mean, actually works on Tuesday, so she never
Okay.
attend classes on Tuesday.
Okay, I understand. But those videos are very informative. Like I was going through yesterday's video and also the presentation. So it becomes very easy to, kind of recall everything back. It's like, it's so live, like the class is happening in front of you,
Yeah.
That's a beauty of technology.
Exactly.
You can hear me?
Welcome back.
So welcome back.
Perfect. Sorry. I don't know from where it gets disconnected. Today is something error happening on my end. I am speaking and suddenly my other laptop gets, the 15-inch gets completely black, and then it says connecting. Then I realized, then I connected with my iPhone's, my phone's hotspot. Hotspot is working fine, but home Wi-Fi is not working. Kya zamana aa gaya yaar?
Yeah, it happens. There's a lot of congestion, you see, everywhere.
Yeah, but the phone is working so nice. The home Wi-Fi is not working.
Yeah.
How bizarre. Anyhow, okay. Acha, so till what area I was doing the badbad, I don't know. Let me check.
You'll have to all over again.
Okay. Yes, I know. Okay, I'm back here. Let me just arrange my second screen. Okay, here it is. And here it is. Okay, so I did all these pelvic floor. I talked about it. Yes, I was here. Okay. Okay, just a second. Once again, play, tuck, 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 and here it is. Okay, so I was at this point, proper training. Okay, I think I talked about the weak glutes and legs, right? Yeah,
We
fine.
spoke about not the legs, the
Acha,
glutes.
okay. Okay, so basically weak glutes and legs, even your leg, if they are not strong enough. So basically glute and your thigh connection is there. So if these two are weak, especially with an anterior pelvic tilt, my friends, okay, with an anterior pelvic tilt, you can have a tight pelvic floor and that can lead to pelvic floor disorder. And that is the reason, think of strengthening the glute muscle. People with back pain can also have a pelvic floor dysfunction. Why? Mostly people with back pain will have an anterior pelvic tilt, right? And with an anterior pelvic tilt, the pelvic floor muscles can be into a problem, disorder. Okay. Now, what is proper training required? In proper training, we need to relax and strengthen. Okay, relax and strengthen. That means what happens? You know what, in Kegel normally what people do, tighten, then release, then they tighten. So the focus in the Kegel is mostly people squeeze, yeah, contract, and
Yeah.
they don't focus on relaxation. They don't focus on relaxing the pelvic floor. So whenever you are doing a Mool Bandha or anything, think about contraction, releasing, contraction, releasing. Okay. And the best thing, my friends, if you want to really do, lie down in a semi-supine position. Okay. With the knees bent like Tadagi Mudra, the feet is flat on the floor, supine position. Add core work and
Yes.
pelvic floor work together. So what you do is inhale, exhale. I slightly engage my TVA, contract, and contract my pelvic floor. So inhale, exhale, inhale, I let the pelvic floor go down, protruding out. Exhale, I let the pelvic floor come back, right? Inhale, exhale. So these movement, my friends, in a supine position, you can add with core engagement, yeah, the TVA, transverse abdominis, as well as the pelvic floor. So whenever you are adding a breathing practices, a simple breathing practice, add these two things together, TVA, transverse abdominis, and your pelvic floor together, in syncing with your breath. And you will have a well-toned pelvic floor muscles. Okay, let's go a little bit more further. Okay, we'll talk about the functions, although I have given you some brief idea. Okay, 52% of athletes experience incontinence. Yeah, 52% of the athletes. Now, you know why. A jumping, a running, any of these exercises, what is happening? The whole abdominal content is pressing where? Pressing to the pelvic floor muscles. The pelvic floor muscles is what it is getting. It is getting weaker because every time jumping, moving around and everything, what is happening whenever you're into sports where there is jumping and moving around, and there is a constant load of the trunk on the intestines, everything coming on your pelvic floor muscles. 52% of them, it showed, a research shows 52% of the athletes experience incontinence. Okay, what else? 49% of chronic low back pain have urinary incontinence.
Yes.
How is that? Right? Because of, I told you, came to that point, anterior pelvic tilt. And that's the reason, my friends, as yoga teachers, let us not focus on one point, focus on as an overall, you know,
Holistic.
just connecting to, yeah, holistic, exactly, holistic, thinking on a holistic point of view. What else? 43% of women and 31% of men experience sexual dysfunction or pain with intercourse. Once again, here, work on the pelvic floor muscles. Moving, Kegel, Ashwini Mudra, Moola Bandh, amazing practice. And one should regularly practice. Okay, let's go with that. Pelvic floor functions. What are its functions? So childbirth and mother, normally, that happens a lot. So prolapsed uterus. So a female, especially who has given birth, will have a high chances of prolapsed uterus. That's the reason adding pelvic floor work in your normal routine practices, like Pavan Muktasan you're doing, Setu Bandhasan you're doing, instead of thinking of, oh, I am working on the back muscles and stuff, why don't you also think that I'm working on the pelvic floor muscles? right?
Uh,
Amazing practice. Yeah.
the
So what will
awareness-
happen? Yeah, it's only the awareness that you have to add, my friends, nothing else. It's only the awareness you have to add. What else? Controls urine and faces. I talked about it. So if it is weak, it cannot control, right? It's weak, it cannot control. What else? Supports the abdominal and the pelvic content. But if you're not working on strengthening the pelvic floor, this whole abdominal content can create a pressure on the pelvic floor. Yeah. Breathing. Definitely, your pelvic floor also helps you in breathing. When you're inhaling, what is happening? The pelvic and the thoracic diaphragm, the pelvic diaphragm, they both work in tandem. They both work in tandem. Okay. That's the reason teach breathing practices with pelvic floor movements. Yeah. Teach breathing practices with pelvic floor movements. Put their awareness. And the best thing is Purna Pavan Muktasana. Only in Purna Pavan Muktasana, because the knee hugs to the chest. The pressure is directly. See, that's the reason. I don't know whether you have experienced or not, but whenever you sit in a Western toilet and whenever you sit in an Indian toilet, the Indian toilet, the evacuation is much smoother. In
Yes.
the Western toilet, there is a pressure to be applied.
Correct.
If someone has ever sat in the Indian, it's like you sit and the evacuation like very smooth. But in the Indian, so in the Western, you have to actually put some pressure, and that pressure comes on your anal sphincters, and that's the reason you have problems with piles, fistula, and other things at the anal region. Why? Because you are applying pressure. While in the Indian style, the thighs are pressing the abdomen cannot expand. So what is going to happen? All the pressure will come on the pelvic floor. Exactly, Deepak. Yeah. All the pressure can easily come on the pelvic floor. Yeah.
Even
Alasana.
today, just sharing something personal. I actually sit on. I put my feet on the seat.
Yes.
I don't put my feet down. My feet are on the seat of the
On the
toilet.
seat.
On the seat. And this is how I sit. Even today.
Okay. That's a good
Yes.
one. That's a good one.
But that's the perfect way of actually
Evacuation, the call of nature. Yeah,
Yes.
100%, 100%. But the only thing you always need to check, is the seat modified for sitting in an Indian toilet? That's very important. That's the reason you see the Indians make the seat very dirty. You always see when you go to the places, especially in the Indian railways. I have seen, although it's a Western, but people will put their feet on the seat and they will, that's the biggest issue actually.
There are types of toilets. Of course, it's available.
Yes.
anywhere
Yeah.
else.
You have a seat also to foot.
Yes.
You have a footprint to sit actually. Yeah.
Correct. And then you've got the seat that comes down if you want to sit.
Yes, exactly. So in there are, but there, some places there is not. But actually, people don't understand. It's a very thin line that they are balancing on. I at times see where there is an Indian, where is a Western, where you have a footprint. It's like an extra ceramic being added, so people can put their feet on it. Understood. But there are places I have seen the edges are very thin, and on that how they balance, I imagine I laugh.
Requires a lot of practice, sir.
Yeah. So that means the person has done good core work
Yes.
to stabilize himself, and on the top of that, the train is moving. It's not that it's static, it is moving. So imagine the amount of stability the person requires to be there. So that's the reason you always find the Indian toilets a little bit dirty compared to any other that I've seen. Yeah.
I was not aware that there is a facility that footprints are there, and though it is a Western,
Yeah. Yes.
there?
Yeah, Mona, it is there. So there are some toilets where the ceramic has a footprint also. It's like you just lift the lid, okay, the seating lid, and you have proper foot position to sit on it. Very proper, yeah.
Wow, that's great.
Yeah,
Hmm.
I'll show you the images a little
It is
later.
there. Yeah. Just I think I can show it later on the Google. You type no Google Western
Yeah,
Indian
I'll see
commode, you will get it.
afterwards.
Yeah.
Yeah. Okay.
Yeah.
Yeah,
It's no problem.
iPhone 7 32
But it
GB
is
आपका मिल जाएगा 40,000 में और iPad
what
मिल
happened.
जाएगा
Very
Okay,
sorry.
The ad is coming, might be, or anything. Yeah.
No, I just pressed on
So
the
that's
wrong
the
button.
season. No worries, don't worry. It's okay. It's okay. It happens. Okay, let's go further. What it is doing, the pelvic floor. Pelvic floor is also Nandini. Namaste. Where are you? Good to see you, Nandini.
Namaste. Namaste.
Hmm. Sorry, I called you in the wrong time, huh?
No problem.
Okay. So stabilizes what? The spine and the pelvic. So once again, the pelvic floor plays an important role in stabilizing the pelvic and the spine as well. What else? Role in sexual. It is said it's an organic Viagra. If you want to really work good on the pelvic floor muscles, it's like an increased orgasm happens when you're actually working on. It's a whole article. Basically, there's a research done. Okay, and I'll share the places where I've taken this research to have an authenticity to it. Okay, let's go with it. Anatomy, go a little bit. Now remember, the pelvic diaphragm, as I told you, has layer 1 superficial, layer 2 intermediate, layer 3. I'm talking about the layer 3. Okay, because the layer 1, layer 2, it doesn't we don't need to have that information. Coccygeus, levator ani group. Okay, so these are the muscle, coccygeus and the levator ani group. So if you see here, you have these different muscles that are getting connected. Okay, if this is actually the lower part of the pubococcygeal, iliococcygeal, and coccygeus. Basically, these are the 3 muscles that we need to focus on. The deep transverse perineal and all these things not required. Piriformis and obturator internus we will cover in hip, external hip rotator muscles when we talk about it. Right now here, ischiocaverous, bulbosus, all these things I don't want to remember. The only thing I want to remember is pelvic diaphragm. We have the levator ani group. Okay, levator ani group. Going deep transverse, superficial. These are some of the layers: coccygeus, iliococcygeal, and pubococcygeus. Okay, so these are the 3. If I say the word levator ani, these are the muscles connecting. Okay, let's go with that a little bit more further. Puborectalis, pubococcygeus, and iliococcygeus. Let's go through it. Now, this is the base. Connects sacrum and pubic symphysis. So basically, if you see the point here, it is connected to the sacrum, that is pubic symphysis. This one is a pubic symphysis. The dot is pubic symphysis, and this is your sacrum. So it is connecting from front to back. Okay. Now, the first one, the muscle is your puborectalis. Now, this muscle is like a U shape. It is connecting to the rectal region, the rectum. Okay. Pubococcygeus, the coccygeus and the pubic bone connecting to the PC, pelvic floor muscles. Okay. It's known as the PC muscles also. Okay. In some of the anatomy books, it is mentioned as PC muscles. So you need to know that PC muscle is a pubic coccygeus, pubococcygeal muscle. The levator ani, in together, puborectalis, pubococcygeus, and iliococcygeus. These 3 muscles are known as the levator ani group. Okay, what it is? Puborectalis, pubococcygeus, and iliococcygeus. You only need to remember levator ani, the levator ani group of muscle. That's it, the pelvic floor. So what it is doing? Levator ani group and coccygeus. Stability and support, abdomen and pelvic organs, resistance against increased intra-abdominal pressure. So whenever there is an intra-abdominal pressure, like you lift some heavy weight, Have you ever seen when you're lifting a very heavy weight, and if it is too much, sometimes gas releases? Have you ever felt that? Yeah. It's like you are lifting something very heavy. It is so much pressure in the trunk that sometimes the gas releases. Why? Because the pelvic floor cannot control it, and that's the reason the pelvic floor strengthening is very important. Yeah. pelvic floor strengthening is very, opening and closing of PF, pelvic floor split. So what we need, we don't need only closing. We don't need tightening all the time. We want this movement. We want this movement of relaxation, contracting, relaxation, contracting. This movement is very important, my friends. Yeah. Now let's try to understand what happens if these muscles are tight. So we don't need a tight pelvic floor if we don't need a weak pelvic floor. You got it? Both is important. Like with any muscle, we don't need a tight muscle. We don't need a weak muscle, but we need a toned muscle. And that's the reason what I said. Stretching is no doubt important, but strengthening is also important. And where we lack as yoga teachers, strengthening. Does it make sense? Yeah. Does it make sense? So that's the reason. Okay, so let's understand tight and weak. If it is tight, difficulty in urination and stool. Okay, because so tight you cannot evacuate. Yeah. What else? Pain in the groin, pelvic, lower back, prostate, while doing sexual intercourse. Right. So if it is tight. And it can be also because of stress, my friends. This region can be also tight because of stress. And nowadays, it's mostly because of stress. Mostly because of stress. Sensitivity of the genitals. Pain with bladder filling and emptying. Whenever you are urinating, okay, you always find that it's a painful procedure. Okay. Difficulty while passing stool. This also happens. So if someone is saying these are the issues, why not try with pelvic floor exercise and see how does that feel? So at least you will have some logic behind, okay, you're having these problems. Let us try working on activeness and passiveness. So let's do some exercises that can activate passive. Try doing both and see what result you get, and get a feedback, because now you know that some of the issues can be because of the pelvic floor. So why not try to do some exercises or asanas that can help to stretch the pelvic floor muscle if it's tight, or if it is weak, let us strengthen and try to see how it can. Yeah. Now, what happens with weak? Leaking, especially when high impact exercises, high impact, like, you know, the high intensity interval training, the jumping jacks and stuff that people are doing nowadays. If you can gradually improve your exercises, well and good. But if one day you are coming and you are just pushing yourself to the extreme without working on the pelvic floor muscles, leaking happens. Yeah. Even a laugh, cough, or sneeze. I don't know whether you felt it, but when you sneeze, there's a whole lot of pressure that comes on your pelvic floor. Yeah. Pelvic floor. And that's the reason it is very important to work on strengthening the pelvic floor. Strengthening. What else? Urinary or fecal. Okay. Incontinence. So once again, because it is weak, the pelvic floor cannot hold it. Yeah, cannot hold it. That's the reason it's very important to do that. Accidental loss of fecal or wind. It does happen, you know, accidental loss of fecal or wind. Same thing. A vaginal, rectal, or uterus prolapse. And I'll tell you in this, friends, the Moola Bandh, especially the Ashwini Mudra, works wonderfully well. Wonderfully well. And I've got great results with it. I've got great results. The only problem is that person who is going through a rectal or a uterus prolapse or a vaginal prolapse have to do it regularly every day. Yes. If that person misses even for a week or so, he will be back to, like at least after 2-3 weeks, he will be back to square one. Okay. That is the reason it is very important, friends, to work on the pelvic floor. Now you have to really think, like there are a lot of things. There is core work, there is shoulders, there is neck. But why don't you make a sequence? Like, and I told you everything. The neck is also important. The chest is also important. The core is also important. The shoulders are very important. You know, like, oh God, how much things should I focus on? But why don't I why not make a sequence every day focusing on different areas?
Whole
right?
body is
And
important.
whole body is important. Yes, Nandini. Whole body is important, right? But so think in that manner that when I'm doing this, okay, I'm working on this muscle also. When I'm doing this, I'm working on the pelvic floor also. And when I'm doing this, I'm thinking about the neck also. This way, my friends, if we can make a sequence in 1 week, 100% in every day, 1 hour, you will cover all the muscles. But your sequencing, your thought process should be like that. Okay, today we are doing mobility, Bhaumuktan series 1. It is very good for this, blah, blah, blah. Okay, let's focus on 15-20 minutes of mobility. But then the next day would be something different. Next day would be something different. This is where your students will enjoy. But every day morning, I start doing mobility, people will start cutting down, right? They will not come to your class. But if you say, today is mobility movement, okay, tomorrow is stability movements, tomorrow is strength, yeah, tomorrow is flexibility. Oh, wow, very nice. And people like, oh yeah, today you're talking about mobility. Yeah, people will do in that manner. That they will, okay, today is this, tomorrow is this, okay, okay, mobility is happening, flexibility is happening, strength is happening, stability is happening. And people will enjoy it. Yeah, then one day do a little bit of cardio here and there. Why not? Do some Pilates, do some TheraBand one day. Yeah, do some ball yoga one day, foam roller one day, and you see you have varieties. Even that 7 days would be less for you. You got it? But you have to really jot down, you know. Okay, erectile dysfunction, definitely weak. And that's the reason, once again, I told it's very good to work. So especially with males, you need to work on this. Risk, okay. So who are at risk with these issues? Which are the people who are at risk? So pregnant women and postnatal, okay, they are at risk. Menopause or post-menopause. Gynecological surgery, prolapse surgery, hysterectomy, okay. Prostate cancer or enlargement. Fitness enthusiasts and athletes also. High, HIIT, high intensity interval training. Why? Because people are so mad to get fit, right? Don't think about it. They just jump into the bandwagon. Oh, I need to lose weight. Okay, let me jump. It takes some time. Strengthen your body. Get to that stage where you can actually jump. Jumping requires some muscles to be, strong. You can't just jump one day directly thinking, okay, today I want to get fit, I want to lose. No, there is a method. Strengthen the muscles. Work on these, work on these, work on these, then go for it. Remember the word progressive strengthening, progressive flexibility, right? Progressive stability, progressive mobility. Anything that happens step by step, you will never have any injuries, not to yourself, not to your students. But if you just jump just because, oh, I used to do 1 month before halasan, I never had a pain, but I think I haven't done it for 1 month. Let me try it today because I knew that the last time when I did, my toes were touching the floor. So this time it should also touch the floor. Then you are in a wrong notion. Yeah, no, it will not. But if you try to do it, get ready for the levator scapulae muscles to be spasmed very easily without any discomfort. Try that out for one month. Don't do anything. Get into halasan. You have your neck in a big issue. Okay. So heat, then what it is? High load. Okay. Anything with high load, gymnast, boot camp, runners, all these things are always, these people are always in a high risk. Okay. Risk increases with heavy weight lifters. Remember, and these people, they lift weight so heavily that the intra-abdominal pressure, whenever the body is lifting very heavy weight, the first problem comes in the trunk, the cylinder region, the cylinder, right? There is very strong intra-abdominal pressure, and that pressure, where it is diverted, because it's a core, whereas the diaphragm is pushing down, it is also pushing down the pelvic floor. And that's the reason heavy weight lifters are always in a risk. Not even heavy weight, even if you're lifting the child that is very heavy, yeah, it can give a pressure to the back and the pelvic floor. Push and strain, constipated. Yeah, people who are constipated, they always put a lot of pressure on the pelvic floor for evacuation. That is the reason they have a problem also. Chronic cough or sneeze, chronic cough. That means it's not only cough, all the time coughing happening. A lot of pressure coming in the abdominal content, or sneezing. Yeah, if you have a sneezing all the time. So people with chronic cough and sneeze, just be careful for their back, because that pressure also comes on your back. So the back problem can aggravate if you are into a chronic cough and sneeze issue. Overweight, definitely overweight is when the abdominal content is higher. Also, it comes a lot of problem on the joints. Also, forceps birth, difficult vaginal delivery, pelvic radiopathy. Okay, all these things, the risk increases. Back pain. Okay, risk increase if person. I told about it because of APT, anterior pelvic tilt. It is bound to happen. Okay. Now let's go with pelvic floor habits. Tight and weak, hypertonic, spasm, or short. Let's go with that. loose and weak, underactive and hypotonic. Sitting, biking or spinning. So whenever you are sitting for a longer period of time, you are biking like me, like cyclist, but those cyclists who are doing it daily, every day because of something, they would have tight. Okay. Or spinning, spinning. Remember here, I have mentioned here tight and weak and loose and weak. In both the cases I have mentioned, because in any of those cases, even if they are tight, it is not getting strong. Remember, okay? Stress can also lead to tight pelvic floor muscles. Okay, what else? Wearing shoe with high heel rise. So if you're 100%, yeah, you need to be, oh Sana, I think I got the right chord. So wearing shoes with high, what, sometimes wearing is not a problem. It's like there are specific days you want to wear, you want to look good, amazing, no doubt, enjoy it. But if that habit is getting on a regular basis, not a problem, big problem actually. You got it? But once you're going for a wedding, you want to look your best, yeah, then on that particular day, any function, amazing, go ahead, enjoy. There's nothing harm in it. Like how we cheat in food, you're cheating in with your gait, with your posture, that's fine. But yes, if you are wearing all the time and it is creating a problem, you need to decide, is looking good important or your posture is important? Okay. PPT, tight glutes, posterior pelvic tilt. So people who are with the posterior pelvic tilt, they will always have a tight glute. People with anterior pelvic tilt will have a weak glute. Got it? Anterior pelvic tilt, no activity in the glutes. Posterior pelvic tilt, tight glutes. Holding tension in pelvic floor muscles. There are many people who hold tension in the pelvic floor muscles. What else? Not walking much. People don't actually, walk. Nowadays, walking has completely stopped because everywhere there is elevators. Even in India nowadays, the stations are having elevators, and you will find less people actually using the steps. More people are nowadays using the elevators. Yeah. So walking has reduced. Not using our hips much. Like hips in the sense movement, all the directions. We are only sitting in and we are doing only one movement. Yeah. Flexion and extension. That's exactly dances, pelvic floor movements. Go for this, what is that? Belly dance. Very good. Your hip is moving in all direction and put some nice shimmering things around. And I'll tell you, you will love it. When you start, seriously, I'll tell you, when I go to the gym, I saw inside the mirror and I do all those movements. Oh, I said, wow, my pelvic is moving. Amazing, right? I'll tell you, it's fun. It's fun.
Yes.
Yeah. And then there's the background music going into the gym, and then you're doing it because the reason behind I go to the gym, I know one thing: when I'm at home, this is in India, it is basically sometimes you need to bring something. So if I'm doing my yoga, a phone call comes, either my son will say something, my daughter will say something. If not, is there my mom and dad will say something. And that's the reason when I go to the gym, I know I'm disconnected for that 1.5 hour. I do my yoga in the gym only so that I'm disconnected with everything, because at home something or the other work comes in and your unnecessary mobile is ringing also at the times. Okay, so use your hip. Lots of Kegel. People who do lots of Kegel can also have tight pelvic floor. Important point here. People, I do pelvic, but still I have a problem. You need to check. Do you really need to tighten, or do you really need to make it flexible? Loose? Can there be a balance on both? We don't need a loose. We don't need a tight. Can there be something in between? So those people who do pelvic floor and say, I do a pelvic floor, but still it is not helping. I do the Kegels. But no. You all the time contracting. No, not going to work. Okay. Loose and weak, jogging, aging, pelvic surgery. Okay. So whenever someone comes with a pelvic floor issue, need to check. Is it because of tightness that the problem is coming? Or is it because of the weakness of the pelvic floor muscles? And this will give you a rough idea about if someone is saying, I have a loose and weak, underactive, hypotonic. What are you doing? Are you doing jogging, running, marathon running? What do you do? Any sports or anything? You never know. The problem is coming from which arena? Is it from the sports? Is it from the jogging, or it is because of the aging? Yeah. Jumping around trampoline or CrossFit. Yeah. Pregnancy and childbirth, anterior pelvic tilt, weak glutes. We talked about that. Constant belly breathing. constant belly breathing. When people do a constant belly breathing also, they have this issue. So be careful. Being overweight, sexual abuse. Okay, being overweight, sexual abuse. So even the sexual abuse can be one of the reasons we need to be very careful about. Laughing, weightlifting with belt. Weightlifting with, what happens with those, people who use those barbell and do the weights, coming to Cherry, they will have a belt. They tie a belt around them. If you have ever seen people, the weightlifters, they will always tie a belt around them and then they lift it up. Yeah. What are they doing with that belt tightening? They are creating more pressure going to the pelvic floor muscle. What is happening? It is going more down. It's going more weak. You got it? So any increase in the intra-abdominal pressure more than normal will have a pressure on the pelvic floor muscle. Yes, Cherry.
Yeah, I have a question. If the someone have the flexible pelvic muscle, it means they have a weak pelvic.
No.
No?
Flexible. No. See, it can be loose. Flexibility and loose are two. Flexibility and strengthening are both connected. So we need a flexible pelvic floor also. So that if I have to evacuate, if I'm going for the call of nature, only if my pelvic floor is flexible, I can release. I can urinate easily, right? So we need, but if it is loose, not flexible, but loose, it cannot hold. Then the problem is there. They cannot control, right? So we need flexibility, but we don't need loose. We need contraction, but we don't need strong tightness, as if it cannot release. And that's the reason we need the contraction, we need the relaxation. Both movements should happen in that. We cannot just keep it tight all the time with stress factors or any other things, or we cannot just keep loose. By doing your work, might be you're doing any jumping around or something like that, that can increase that. We don't need both either. Somewhere in between. Yes, Nandini. Yeah, is it okay, Cherry?
One more. Sorry, one
Yeah,
more.
Please.
Yeah, for the woman have the birth baby or miscarriage, it can lose the strength muscle around the pelvic.
Pelvic floor, yes, 100%. And that's the reason it is good to start your pelvic floor exercises before giving birth. Because normally what will happen, Cherry, as and when the semesters would pass by, 2 months, 3 months, 4 months, what will happen? Because of the abdomen enlarging, you will automatically have an anterior pelvic tilt, and the anterior pelvic tilt will cause pressure on the pelvic floor. That can lead to more problems. That is the reason before you plan a family, it's good always to start with working on strengthening of the pelvic floor muscles, stretching of the pelvic floor muscles. We need a toned pelvic floor high with any other muscle in the body. It requires flexibility and strength both, right? We cannot just depend on only one thing. Yeah, is it clear, Cherry?
Thank you.
You're welcome. Yes, Nandini.
Yeah, I had my father-in-law. He had he cannot pee, and he used to go to the toilet, and his bladder will be full, but he cannot pee. So it just comes a little pee and then stops, little pee and then stops, like that. So what needs to be strengthened?
You know what? Try to do, because he cannot pee, that means either the pelvic floor muscles are too tight. Try to give him belly breathing where he can relax, activate his parasympathetic nervous system, the rest and digest response. Sometimes due to any stress or subconscious stress, the pelvic floor has been tightened. It cannot release. It cannot, it doesn't give space to flow. A good practice would be something that relaxes, and nothing like a belly breathing. Nothing like a belly breathing. If you see in this, I have mentioned loose and weak. Why? Because a person is constantly doing a belly breathing. But in the case of a person who is having tight pelvic floor, give them belly breathing. That will relax them. That will activate more the rest and digest response. It would be more helpful. Got it?
Even for the female people also, The same
It
thing,
depends.
belly breathing.
It depends. Is it tight? Is it weak? According to that, you have to plan.
Okay.
Yeah. Is it so? You have to always, friends, come to a conclusion. Is it tight? Is it weak? Then your work starts. Got it. So when the student comes, he will complain, I cannot urinate, or I cannot hold, and according to that, you have to have a questionnaire, as I told you, the
The same
case study.
problem like my father-in-law, same problem.
Perfect. Then
Like
do
can
some
pee, can't pee, can pee, cannot, but bladder will be
relaxation.
full.
Nandini, relaxation, and Ashwini Mudra. We will talk about tomorrow. I think we have a few more slides. Coughing, evacuation, sneezing. Okay, we will go through it tomorrow also. A few more slides. We will cover it tomorrow. It's already now time up. Okay.
Thank you.
So, yeah. So we will cover, I think, 1, 2, 4, 3, 4 slides or more. We'll cover that out. Okay. So, but up till now, is it getting clear, whatever that we are talking about? Yeah. Did you understand why we need to have a toned pelvic floor, right? Why we need to have a toned pelvic floor and not only strong or not only flexible, both required. Yeah. Does it make sense?
Absolutely.
Yeah. Perfect. Okay, come. Let's sit in a tall position. Keep our spine straight, chin tuck, lengthen from the crown of the head. And you know what you do now? Slightly contract the pelvic floor. Slightly contract the pelvic floor and keep it contracted to whatever duration you can. If you cannot contract, let it go down. Once again, try to contract the pelvic floor. Hold that pelvic floor. Slightly contracting. And now see what is happening to the abdominal region when you are contracting that pelvic floor. Loosen the pelvic floor. See what is happening to the abdomen while your eyes are closed. Yeah. Now slightly contract the pelvic floor, and what is happening to the abdominal region? Try to observe it. Can you feel your transverse abdominis gets a little bit more tighter, slightly more active? Try to observe that. Loosen it. See what's happening. Tighten it. What's happening? Just observe it. Now what I want to do is tighten, slightly contract the pelvic floor, and then do Kapalbhati. Then loosen the pelvic floor and do Kapalbhati. See the difference between both. See the difference between both. I want you to contract the pelvic floor, do a Kapalbhati 5-6 times only. Then loosen the pelvic floor, do the Kapalbhati. See the difference. Does it make any difference, or is it the same? You need to have that mindfulness, my friends. Makes a difference, Deepak?
Big difference, sir.
Big difference, right? Big difference. And that's the reason I always recommend do Kapalbhati with slight pelvic floor engagement. You got it? Why? Otherwise, it's like a cough. Like what happens is cough on a sneeze, right? And you cough.
It's also good for bronchitis. Sorry.
Yes.
Hernia. Hiatus hernia.
No. Yeah, not good.
But that gives a lot of pressure, right? It gives a lot of pressure to the It's
But
in
when
fact,
you contract and do it, it's good or not? No.
Oh, with hernia.
No, not hernia. It is not. I will not recommend it. I will not recommend it.
Thanks.
Hernia,
Thank
because what does hernia means? Displacement of an organ from its normal place, right? It has just shifted somewhere. That's the reason avoid it. Okay, anyhow.
Hiatus hernia. Yeah.
Okay, just keep your spine straight, chin tucked, lengthen from the crown of the head. Observe your breath. Shanti. 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 Thank you, Sana. Thank you, Nandini, Cherry, Deepak, Subhash, and Mona. Thank you.
Thank you.
I will see you tomorrow, same time. Take care. Keep smiling. Namaste. Bye-bye. Bye, everyone. Bye, Mona.